Alright, I gotta talk to my fellow white people here for a second. Someone sent me this video, but this comment, as many much smarter people than me have already said, racism is abuse. Ibram Kendi says, and I'm paraphrasing, but you cannot sit on the fence when it comes to racism. You are either being racist. There are either racist ideas or there are anti-racist ideas. There is either racist prejudice or there is anti-racist prejudice. Ibram Kendi says there may be no more consequential white privilege than life itself. White lives matter to the tune of 3.5 additional years over black lives in the United States, which is just the most glaring of a host of health disparities, starting from infancy, where black infants are more than twice as likely to die than white infants, where black women are significantly more likely to experience maternal mortality, and that number has just risen during the pandemic. Now, there are a lot of lies that have been spread about the black community that are still prevalent in today's society, but especially in terms of medical care. Lies such as the idea that black people have thicker skin or black people cannot feel pain as much were championed by doctors and scientists to justify enslaving people. But these disparities still exist. The quote-unquote father of modern gynecology practiced his surgeries on enslaved black women. And you can read his biographies where he talks about these enslaved women that he tortures, but they're fucking foul. But to deny that racial prejudice exists in healthcare is to not only deny history, but is also to deny our current society. It's a false equivalency to say, what if a white woman came into the hospital and asked for a white nurse? The idea of a racial hierarchy was created by white people with white people at the top of the food chain. So to try and reverse things does nothing but prioritize your own feelings over people's actual lives. Just in case you didn't get it, let me paraphrase. Black people are more likely to die. And death is just one thing because black people are significantly less likely to receive proper treatment for their medical issues. This is an undeniable fact, and that it has to be explained to you, someone in the medical field, is very concerning. It shows that woman was right in her assessment of you because you don't take her life seriously. Now I'm going to read you another expert from this book, but if you've seen all of this data, you've learned a little bit about the history of your field, and you're serious about your patients and you'd like them to receive the best possible care, I recommend you read this book. But if you don't have the attention span for a full book, just take 2 seconds and look up racial disparities in the medical field. Racist and anti-racist are like peelable name tags that are placed and replaced based on what someone is doing, supporting, or expressing in each moment. These are not permanent tattoos. No one becomes a racist or an anti-racist. We can only strive to be one or the other. We can unknowingly strive to be a racist. We can knowingly strive to be an anti-racist. Like fighting an addiction, being an anti-racist requires persistent self-awareness, constant self-criticism, and regular self-examination. Racist ideas have defined our society since its beginning and can feel so natural and obvious to be banal, but anti-racist ideas remain difficult to comprehend, in a part because they go against the flow of this country's history. And there's a reason why the white people in charge don't want this history being taught, right? Because we're not anywhere near any actual social progress. But if y'all go watch this video, should I address what Jeff says about the hair thing? Oh my god. The video is the dumbest shit I've ever heard. Holy shit.